Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to do if you miss a birth control pill? The simple facts are this: if you missed one birth control pill, you are still protected so long as you catch up within 24 hours. If you missed two birth control pills, you have lost protection against pregnancy and need to use emergency contraception if you had condomless sex. If you miss 3 birth control pills, you need to use condoms for the next 7 days until you are back on track. /r/n/r/n. That's just a brief overview of the things you need to know if you miss one or more doses of an oral contraceptive. Learn more about what to do and what to expect if you miss doses of a combination birth control pill, the pill, or a progestin-only minipill. /r/n/r/n. A combination birth control pill, also known as the pill, contains both estrogen and progestin. Estrogen works by suppressing ovulation, the release of a mature egg, while progestin thickens mucus at the entrance to the uterus, womb, so that sperm cannot reach the egg and fertilize it. /r/n/r/n. Because of this 2-in-1 effect, combination oral contraceptives are slightly more effective than the mini pill. Even so, the effectiveness of the pill can wane if doses are missed or skipped. /r/n/r/n. If you miss one pill, take the missed dose as soon as you remember and take the upcoming dose at your regular time. If you only realize you missed a dose at your regular time, take both pills together at once. /r/n/r/n. Missing one pill slightly increases your chance of pregnancy. According to a 2023 study in Obstetrics and Gynecology involving 2,837 people on combination birth control pills, the risk of pregnancy after one missed dose is around 0.25%. While low, this is still 3 times greater than if you miss no doses. /r/n/r/n. Just to be safe, consider using a backup method of birth control, such as a condom, diaphragm, or sponge. You do not need an emergency contraceptive, aka the morning after pill, if you had unprotected sex the night before. /r/n/r/n. If you miss 2 pills in a row, take the 2 pills together as soon as you remember and 2 pills the following day. Due to the higher dose of hormones, you may experience spotting and possibly nausea. /r/n/r/n. Use a backup birth control method for at least 7 days, because it takes a full 7 days of consistent dosing to restore optimal protection against pregnancy. /r/n/r/n. Use emergency contraception if you have had unprotected intercourse. Studies suggest that your risk of pregnancy is 10 times greater if you miss 2 consecutive doses compared to missing no doses. /r/n/r/n. If you have missed 3 or more pills in a row, you are vulnerable to pregnancy. To get you back on track, you can either /r/n/r/n. consider using emergency contraception if you had unprotected sex after missing your pills for 48 to 72 hours. /r/n/r/n. There is no evidence that taking 3 birth control pills at once will protect you from pregnancy any better than 2 if you miss multiple doses. What it may do is increase your risk of side effects, which can include :/r/n/r/n. Most combination birth control pills have placebo, inactive, pills that don't contain any hormones. For most brands, the pills for the first 3 weeks of a 28-day pack contain hormones, while those for the last 7 days do not contain any hormones at all. /r/n/r/n. If you miss birth control pills during the placebo week, you are not at risk of becoming pregnant. Placebo pills are simply meant to keep you on schedule for taking pills. If you missed a placebo dose, simply get back to your regular dosing schedule and try not to skip any other doses. /r/n/r/n. The progestin-only pill, or mini-pill, does not contain any estrogen. /r/n/r/n. While combination birth control pills have a drug half-life of around 24 hours, meaning that 50% of the drug will have left your system after 24 hours. Minipills have a drug half-life of only 12 hours. Because of this, the umbrella of protection is notably smaller, and missing doses place you at greater risk of pregnancy. /r/n/r/n If it has been less than 3 hours since your scheduled dose, take the missed dose as soon as you remember. A backup method of birth control is not required. /r/n/r/n If you are more than 3 hours late taking the mini pill, take your missed pill as soon as possible. Return to your regular schedule the following day. Use a backup birth control method for the next 2 days. /r/n/r/n If you miss a mini pill and don't remember until the next day, take your missed pill as soon as possible. Take your next pill at your scheduled time. /r/n/r/n If you are a day late taking your mini pill, use a backup birth control method for the next 7 days. /r/n/r/n When taken as directed, combination birth control pills offer greater than 99% protection against pregnancy. In fact, the same study published in Obstetrics and Gynecology suggests that the conception failure rate defined as the risk of pregnancy within the first 12 months of starting birth control was only 0.09% with perfect use. /r/n/r/n However, if only 3 consecutive doses are missed, your risk of pregnancy increases by nearly 14-fold. /r/n/r/n To better protect against unintended pregnancy, you'll need a backup birth control method, some of which work better than others. /r/n/r/n The type of pill you take along with the duration of the treatment gap make a big difference as to whether you need a backup birth control method, and how long you need to use it. If in doubt, speak with your healthcare provider or a community-based sexual health organization like Planned Parenthood. /r/n/r/n Missing birth control pills can have an impact on your menstrual cycle and symptoms. If you take the pill to help decrease heavy bleeding and menstrual pain, missing one or more pills can cause changes to your period for a cycle or two. /r/n/r/n Symptoms may include /r/n/r/n Hormones can be unpredictable. One person may have problems after a missed pill while another won't. If you miss your pill and are concerned about the return of heavy bleeding, contact a healthcare provider. They may be able to help you avoid symptoms and get your cycle back on track. /r/n/r/n While anyone can miss a pill now and then, it's best to minimize how often you forget to take it. You may want to try several strategies to help you be consistent. /r/n/r/n It also helps to know how to use emergency contraceptives if you happen to miss doses and have unprotected sex. /r/n/r/n It's important to take your birth control pill to avoid an unintended pregnancy. If you miss a dose, you may need to take special steps to catch up depending on how long ago you missed the pill, the number of doses you missed, and which type of pill you take. /r/n/r/n You may also need to use a backup birth control method until you've built up enough hormones in your system to be fully protected from pregnancy. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.